This is the last video on paracetamol overdoses, so well done if you're still watching. And we're going to be talking about when you should be calling a toxicologist or poisons information center to discuss a paracetamol overdose. Now, clearly, you can call for advice whenever you need advice. So if you're just uncertain about how to deal with a fairly standard overdose, that's an acceptable reason to call for help. But these are some reasons that should prompt anyone to consult a toxicologist if possible. The first scenario is very large overdoses of bigger than 50 grams or 1 gram per kilo. And that's because these patients have a likelihood of getting seriously unwell and they may require specialized treatment regimens. The second scenario when you should call a toxicologist is if your paracetamol level comes back triple the nomogram treatment line. And this is again because specialized treatment might be required that's different from the standard guidelines. The third scenario I want to talk about is where you have unchanged or increasing paracetamol concentrations when you do your serial blood tests. And the reason why this is a concern is that it suggests that something is going on in the gut, i.e. that you're getting continued absorption of paracetamol, and that also should prompt some consideration of additional treatment. Any intravenous error should be discussed with a toxicologist. And by intravenous error, I mean a paracetamol overdose, whether deliberate or inadvertent, that was given through the intravenous route. So someone's getting IV paracetamol. And the reason for this is that you get a lot more paracetamol a lot faster when you're given it intravenously. So the overdoses via this route have the potential to cause greater damage. Any patient with clear evidence of hepatotoxicity, defined as an ALT greater than 1,000, should be discussed by a toxicologist at the earliest possible time. And finally, any overdose occurring in the context of a neonate should be discussed, as neonates have quite different physiology and drug metabolism compared to older children and adults.